Absolutely. Oh my God, Porshika, thank you for that warm welcome. I was a little choky. Reminiscing 2008, 2009, when you were defending your thesis and I was just a poor grad student watching your glossary for D&I. It was awesome. It's been an amazing journey, and it's so nice to be able to call you all colleagues and friends as I embark on this directorship. It's both terrifying and exciting at the same time. It's like we're a small university. We have a small cohort of folks that do this, but we are also in a place that requires this so critically. We really need to focus on the inequities that are all around us in this space in New Mexico. And I do think that D&I and advancing some of the sciences over here will help us really incorporate equity not only into the process, but in specific outcomes that we ensure that we measure and we impact in our community. So with that, maybe I'll have to come back with a new presentation and ask for the center a little bit later, because I'm literally in the second month of this and I am still finding my feet and what am I supposed to do and how can I do it and how far can I stretch things. But I'm very grateful to have Doug Ziodonis supporting some of this work. So it's been an incredible journey. Just a lot going on at the moment. And so I'll come back to you guys with that. Without further ado, though, I think I have to confess that the title of this talk is way more awesome than the actual content of this talk, and actually my understanding of fidelity and adaptations. And I'll tell you why. This has been like, for me, a love and hate relationships, just because I have always been from that pragmatic school of things. And as a clinician, as a primary care clinician, seeing the impact in the clinic has always kept research on a second priority for me. And so fidelity within it has always been sort of a second priority. But as I have become a D&I scientist, I've really thought about the importance of fidelity. And that is the love part of it, right? Like, so if we don't know whether we are actually delivering the intervention as intended, we don't know if we are having that impact, right? And so it's been the other part of the hate relationship has always been also grant writing. So the reason when Rachel came to me and said, you want to write this chapter with me a few years ago, I was like, oh, this might be my opportunity to actually learn how to write this better. And so this has been a learning journey over 3-4 years, and especially preparing for this presentation. I think I took a much more conceptual deep dive, so it might get a little boring. So please feel free in putting chat and thoughts in the mind. What I've left for is a few minutes for a good reflective discussion, especially as all of this relates to our ultimate goal of sustainability, our ultimate goal of addressing inequities. So as I walk through this history of fidelity, do keep that in mind. And with that, I'll start sharing my screen. And good view? Yeah. You see the right view? Okay.
Yes, perfect. I love of course, the dance.
Well, I had to have like some dance emojis, right? Like, it does harp on my love for dance. So this is good. It was really fun to like come up with this title. So for me today, what I geared this presentation towards is just presenting to you some of the conceptual considerations for fidelity, including what has been promoted in the chapter, that is a broader discussion on identifying factors that influence fidelity. We'll examine some relationships between, of course, implementation fidelity and adaptations, but also implementation strategies, complex interventions, and pragmatic studies. These are some of the aspects that really need to explore fidelity as we conceptualize it. And then we'll talk about some examples that have really done very well, some of the fidelity assessments. And then we'll end with some reflection questions on where does the field go next. So why pay attention to fidelity? I told you about my love-hate relationship, but there is evidence apart from that on that better fidelity is associated with better health outcomes. Although some of the newer research and newer studies are sort of questioning that, I've had amazing conversations with colleagues in really going deeper in spaces of equities, inequities, when addressing inequities, what really matters? Is it the fidelity to the intervention? Is it the fidelity to the strategy that we are using to deliver that intervention? Or is it the overall sort of ownership of that intervention that deliverers might take, and that might lead to a different level of impact, So there's a lot of thinking to do in that space. However, fidelity assessments often allow you to identify what that minimal dose of intervention is, what those active ingredients are that would be required to produce change and impact health outcomes. And this has further on carried in the space of core and adaptable elements and making sure that we understand those concretely. Often fidelity assessments can help you detect the problems with interventions, make corrections, and provide encouragements to the deliverers, especially when delivering interventions. So these are the strategies that you might take to enhance fidelity. So only through assessment would you be able to do that. And if it was not fully implemented or properly implemented, that could also help with the interpretation of results. Although in my review of literature, we are yet to see more research on actually testing the quantitatively the relationship between fidelity and health outcomes as widely as you would think it would be there right now. And most importantly, I think it facilitates replication. But this is a big reflection question that I have, is how much of our science is actually geared towards replication? And how does this then help us or assist us in moving that component of our scientific enterprise forward? It is a key implementation indicator in Proctor's outcomes framework, which they define as the degree to which an intervention was implemented as it was prescribed in the original protocol. And they really talk about measuring fidelity with at least three minimum components: adherence to the program protocol, dose or amount of the program delivered, and the quality of program delivery. So at minimum, if you're ever thinking about fidelity assessments, you want to go with these three is what is the recommended guidance in the IS literature. But let's go a little bit deeper and really think about what is fidelity, right? So it refers to the degree to which an intervention or a program is delivered and implemented as intended. It focuses on the core components. It includes all of the techniques, contents, and methods prescribed by the program developers. And then it really overarchingly considers how well the intervention was integrated into the target setting, the extent to which staff members are trained and support its delivery, and how closely the intervention aligns with goals and resources. Now, as I've spoken through these three bullet points, I'm sure for you all, different concepts in implementation science have arisen, right? Sustainability, penetration or uptake or maintenance come to mind. So all of these really are related to thinking about fidelity and overarchingly its importance in implementation science. So let me begin with just drawing out the history of how we've conceptualized fidelity through various conceptual frameworks. And I think even in the chapter, we sort of base a lot of our conceptual thinking in fidelity on this National Institutes of Health Behavior Change Consortium that came together to think about what they referred to at that point as treatment fidelity. And they came up with these 5 components that that they call recommendations to enhance the reporting and the assessment of fidelity. And they talked about study design, training the providers that are delivering the intervention. They talked about delivery of the treatment. So what is taught, receipt of the treatment, what is learned, and enactment of treatment skills. So what is actually used by the participants. And these two, I think, delivery and receipt, if you dig in a little bit further on those two aspects, for each of these aspects, actually, the consortium provided specific recommendations. But if you look at the delivery of treatment, they really drill down to controlling for provider differences, reducing differences within the treatments received, ensuring adherence to treatment protocol, minimizing contamination between conditions. And when you think about the receipt, they really talk about the participant comprehension and their use and ability to perform the behavioral skills that are put forth by the behavioral intervention. So you see, this gets really conceptually very, very strict methodologically. Like, what is it that we mean by fidelity and how do we want to measure it? How do we want to like control it and make sure that we are assessing it in that controlled environment? And you can tell that that is written by, trialists and interventionists and people that have done a lot of efficacy studies. I really loved that they conceptually set this forward. However, my favorite part of this article is actually this letter to the editor by Susan Mishi. And she actually, I don't know what's the right word to say here, but I thought provided some additional guidance in interpreting some of this strict guidelines for fidelity. And I think the couple of things that if you see, she says, the approach may be actually a very big barrier to theoretical and empirical work needed for the development of science and practice of interventions, right? So if we become so trialist and efficacy oriented, we may not be actually paying more attention to the delivery of these interventions, which is an important science by and in itself to also understand, right? So it, just a couple of quotes from this letter, and I completely encourage you if you are interested in this field to read this. It does not matter whether the planned intervention is a flexible application of behavioral components or whether it is a rigid or manualized. One should be clear about which it is. So she's asking for more theoretical understanding of how each interventionist conceptualizes fidelity and then assess it accordingly. So I think that's the part where for me is being like the hard work is when you take an intervention, either you're adapting it or you're designing it, doing the hard work to conceptually and theoretically justify its core components and its what should be the fidelity assessments that are needed is something that's, I think, we're not paying enough attention to in our literature, in our work. And often due to feasibility, what all can you do in like a 5-year NIH grant, right? I think here is where you start to see her inclination towards implementation science as well, where she says you need to advance both the understanding of the theoretical basis of behavioral change, but also the pragmatic difficulties of intervention delivery. And I really thought that that conceptualized it for me quite a bit. Like, yes, we need to do this fidelity assessment in this conceptual way, but we also want to like keep it pragmatic and think about, what is it and how does it impact intervention delivery? So based on that framework, this is the most widely cited framework. Carroll et al. In 2007 sort of developed a more model kind of thing to show relationships between all of these fidelity constructs. So what they are really doing is starting to push the field forward on how does it influence outcomes, how does the process look, and what would be some potential moderators in this space. And they really go and focus. So if you see this circle on the top, I don't know if you can see my arrow. Like, do you see my, oh, perfect. If you see this moderators box and how are we ensuring adherence to the intervention to ensure that the outcomes are achieved. So they started bringing relationships together in the constructs that were talked about. And what they really harped on was these three constructs: adherence, dose, and quality. Remember, this is also what has carried forward in implementation science as well as important constructs to measure at minimum if you are thinking about fidelity of your intervention. Now, this has situated the field for quite a bit, and there have been a couple of adaptations on this framework. Well, that's interesting, adaptations on the framework. So a couple of spaces in which this has advanced, this modified version by Hassan et al. In 2010 actually added 2 additional factors to that original model. And what they said over here is that they were trying to contextualize it more in the complex intervention space and really emphasize the context of the intervention being an important moderator to consider when thinking about fidelity. And they also focused a lot on recruitment, which again is my tension between being pragmatic and a researcher is, okay, well, in the real world setting, recruitment is not a challenge. And so how do you balance that with, but perhaps it's the characteristics of the populations that may be included in your intervention versus not. And so that was an additional two constructs that they added to this understanding of implementation for fidelity. Here's why we all are, right? Like, how does this compare to adaptations? And this is the title of the work group, so I had to do this justice, right? Like when we think about implementation fidelity, and how do we consider it in respect to adaptations? That's a tricky balance always, and there is a fine line. But I think this is a slide, I'm just talking about, there are differences. It might look like it's versus each other, but I think what we've really, what I wanted to really make a point of today is that it has to be a dance between the two, right? It doesn't have to be one or the other. And we have to move towards this paradigm that allows for both assessments and understanding the impact of adaptations and fidelity on interventions, as well as intervention delivery. So hopefully in that frame, this makes sense, where we are trying to say that let's move away from thinking about either or, but understanding and measuring both and assessing it, like comprehensively both of those within an intervention delivery project. So what modifications are being made to the intervention? Why did they occur? And I know that you're going to be hearing more in the next. So this is really nicely tied, fidelity, and then next month you're going to hear about adaptations and some of the recent advances there. And this idea of planned modifications. So it's not like, let's let the intervention do its own thing, but we are proactively planning for contextual considerations. We are proactively planning for population considerations, setting considerations, and not like leaving the intervention be. The second idea is to move away from this space. And that is why that letter of editor is so important to me always, to have strict fidelity at all times towards understanding that adaptations happen and that we should proactively plan for and document them to understand them. They're not incompatible is what the other thought over here is, that in fact, I think like with some of the recent literature around adaptations, adaptomes, there's actually encouragement to document them and make sure that we are actually comprehensively understanding the kinds of adaptations and the kinds of reasons for why these adaptations happen. And especially when we are thinking about inequities, those become even more important to document and ensure that there's appropriate justification behind those. So how do you balance that? This was the after this you can like tune out of this presentation, right? Like this is the money slide. What do we call it, right? In presentations, it's making sure that you're identifying the core components, making sure you're assessing whether they are fidelity consistent or inconsistent modifications, engaging stakeholders early and throughout, making these planned and intentional rather than accidental through planning, and then assessing these both throughout the process of research. So that's sort of like, I love that this really comes from Rachel's slide sets, where she always emphasizes on these points. And I think that's the only way I've seen balancing both. Now, don't ask me if this gets reviewed well in the study section. So that's where I have had my challenges with this space. And don't ask me the feasibility of doing this with my stakeholders. I feel like some of my community partners and stakeholders like look at me and be like, what? We are doing what? For what? And so it becomes a little bit of a challenge to ensure that all of the partnership in your projects understand the reason and the rationale behind measuring and assessing such in-depth fidelity and both adaptations. So that's been where I think like it's really nicely said in a beautiful slide, but I think operationalizing it and getting it done in a research project with multiple partners with a complex intervention in a pragmatic study, everything starts falling apart a little bit. But that's not to say that just because I didn't do it, I'm going to be, that is why I rely on literature, right? Like that's why there are amazing examples of people who have done this. And I'm hoping to end our presentation through that space so that you guys get some tangible takeaways from this work. There's a big debate. I'm just going on this theme of adaptations and fidelity still. And there's a big debate on, what's a go and what's a no-go adaptation. There's not enough information on identifying and delineating these in the original research. The logic behind why an element is core is based usually on theory and not supported by empirical data. So how do we achieve both of those? And then truly to understand what are those core and adaptable elements, you need several studies over several time periods in different settings with different populations to really try to understand what is that core component of research, right? And so these are challenges that the field of adaptation is tackling and working through conceptual frameworks to be better over here. But this does have an impact on fidelity as well. And let me just ground us all in the second part of my title, right? That shimmying our way to sustainability, because all of this really is towards this goal of sustainability and making sure that interventions don't lose their value and importance as they get adapted, may not be as well researched in the fidelity space across time, right? So I love this framework, and I think this is what grounded my understanding of fidelity and adaptations a lot early on, where the authors actually write that change is constant. And I've heard David speak about this much more eloquently than I'm going to like tell you, but this idea of program drift, where the effect of the program is going to decrease over time as interventions are adapted, or the idea of a voltage drop in which the effect of the intervention decreases as you move it from efficacy, effectiveness to D&I studies. And to address these two conceptual areas, this was a framework that actually suggested this new paradigm to recognize this idea of continuous improvement in our interventions so that we are always going towards sustainability, right? So ensuring fit, ensuring adaptations, ensuring fidelity in a continuous way so that we could goal towards sustainability. And I think that's where, for me, conceptually, fidelity and adaptation assessments rest, is that how are we going towards that goal eventually? And it's not that it's not going to happen, but how do we accurately assess and develop it so as to, I love this idea of fit, so as to demonstrate fit within these new contexts, new settings to achieve sustainability of the intervention. So there has been the second that I said, an adaptation of the Carroll framework to actually incorporate this adaptation work. And this was in 2016 by Perez et al., where they actually modified, if you remember that earlier framework, to say first that you really need to include descriptors of fidelity and adaptation. You need to think about strategies to facilitate a adaptation and fidelity balance. They didn't change the potential moderators much, but they said that interventions should be talked about as adaptive interventions, right? Instead of just calling them interventions. And then as you think about these strategies to facilitate the adaptation and fidelity balance, you want to make sure that you're evaluating those as well and ensuring that that then gets into account for this pathway of the intervention to outcomes. So I thought this was a really nice framework to like bring that adaptations and fidelity balance, and hopefully this can help inform some of your work as you're thinking about it as well. For our chapter, one of the other aspects that we tried to like bring together in this space was thinking about the specific factors that actually influence fidelity. And by doing that, so till now, the conceptual basis has been really what is fidelity? How does it play a role in interventions and outcomes? But what we tried to push the field forward in this chapter is by actually identifying what influences fidelity. And so hopefully, this can help us then promote an understanding of what strategies might be helpful to then achieve that fidelity adaptation balance. So I just wanted to contextualize that some of the conceptual thinkings have been a little bit different than what we were trying to produce in this chapter. And so just taking it a little bit further, what do we mean by, and this really borrows very much, you'll see, from the diffusion of innovations theory, right? Who are the implementers? Who are the receivers? So population characteristics and implementer characteristics. And then what is the characteristic of the intervention? And what is the characteristic of the setting or the organization or the context in which it is being delivered? So you can see less experienced, untrained implementers may be less able to anticipate those implementation challenges and may have issues with fidelity. Highly complex, low relative advantage interventions. I have a really nice example of this in the next few slides. May be difficult to deliver or received, or have participants enact anything about it, like prevention research. Can you think about that? Like, it doesn't have a very big impact immediately on the life. It has like a 10 to 20-year impact. Organizational resources can have an impact, and differences within populations can influence relevance. So now as you think about these characteristics, you can think about strategies that can help enhance these characteristics to ensure that we are achieving the fidelity and adaptation balance. There have been additional recommendations in the field as latest as 2020. And I think this is very consistent with what we've spoken about, think about fidelity, consider strategies to both enhance and assess fidelity, making use of existing frameworks, quality, balance. The two things that I wanted to highlight over here in these recommendations is the first one, in how do we define and conceptualize fidelity for the intervention that we are working on. And I think that is where the hard work of like the original intervention developers, but also the people who are implementing it, also have to conceptualize and think about that. And I think that's where it's a to me, at least in my work, it has been like a nuisance value that if I don't do it, nobody's going to pick me up on it. But if I do it, it's going to help strengthen my arguments for the research and the impact. So it's been an interesting space to be in terms of research. And then the last one that I wanted to definitely harp on a little bit is this idea of distinguishing between strategies that help enhance fidelity and strategies that are used to assess fidelity. So those are two different things. And I think we need to be very clear in our research writing and our reporting. What were the strategies that helped enhance fidelity versus how did we assess or measure fidelity? So I think that's the end of the conceptual. So hopefully this is the boring part is over. And then we can sort of start talking a little bit in rapid fire if we want to. What is it that we see relationships of fidelity with specific newer concepts that are coming up in implementation science, right? So for me, one of the big things was the strategies piece. We have been encouraged to think about strategies as interventions by and in itself that achieve implementation outcomes. So yes, there are specific strategies that could aid in facilitating or improving fidelity, like audit and feedback or facilitation, among others. But we have to also recognize that that implementation strategy is also an intervention. And in reporting and specifying that, are we thinking of the fidelity of that strategy as well? So a couple of folks have written about this, and that fidelity assessments of the strategies itself are also important as we think about the mechanics of strategies or specifying these strategies or justification of strategies. However, they've shown that this has been very insufficiently done in the current literature. And I loved that. I just wanted to give this as a tool for you guys if you do decide to go this route, and it has helped me in my work. It built on the review of research on fidelity of implementation by Dusenberry. But then what they did is that they operated it for implementation, operationalized it for implementation strategies. So how would you think of adherence for a strategy, right? Specifying the implementation strategy, evidence of extent to which these implementation strategies took place. And what I didn't include over here and is in table 1 is the specific checklist that they have for the implementation strategies and how they achieved fidelity over there. Similarly, they think of dose, and now you're seeing the overlap of this with Proctor's specifying and reporting criteria as well. But then participant responsiveness is a little bit different in that it is the extent to which intervention providers are involved in the development of the strategy, evaluation, and are receptive to that implementation strategy. So this is just a new tool. I didn't see any studies that have used it, but I didn't look deep enough. So forgive me for that. But maybe there is additional literature in this space that has taken this and applied it for implementation strategies. Just thinking about its relationship to complex interventions, there is a lot that goes into complex interventions, multiple components, multiple core components, multiple people. So I love this article by Ginsberg and colleagues where they actually identified 6 challenges that were very critical to complex interventions in the idea that you need to develop succinct tools, pragmatic tools, determine which components to emphasize for fidelity. I thought that number 3 was very important, especially when we do group level and multi-level interventions. Where are we basing the fidelity on? What unit of analysis is this? At the individual level of delivery or at the group level of delivery or the community level delivery? And I think that fidelity understanding was, I think, missing from the previous conceptual spaces. And I think they added this for complex interventions. How to deal with missing data problems, how to respond to failures and deviations for overall fidelity assessment, and then ensuring fidelity doesn't assess or threaten doesn't threaten internal validity. So they provide a really nice guidelines of like how you might address these complex intervention challenges as well to ensure that we are, undertaking the theoretical and empirical work, using multiple methods, ensuring that fidelity data are complete, which is so challenging in a research study, but
Yeah,
attending to psychometric.
I mean, I want to do it, but it would take some coordination.
Yes. Multi-site interventions delivered by single trained resource processes, and how do you assess that? And then building some of these assessments right into the intervention delivery space, which might be helpful and easier. One of the things why I like this article actually was building on some of the work that, some of the challenges that Ginsberg proposed in saying that there are like systematic ways to actually develop your fidelity checklist. So they give a very nice step-by-step process to developing your own fidelity checklists. And of course, the gold standard in fidelity assessments is actual direct observation, audio, video, whatever that might be. But checklists have become like a nice way to feasibly assess fidelity. And so they have created this very systematic process of developing that. And what was awesome is one of the examples actually builds on this checklist and actually produce their own fidelity checklists. So I'll show you that example in a bit. And you can't like not talk to this group and like not refer to pragmatic studies, right? And so this is a whole different field that we have to really think about in how do you ensure fidelity report assessments in pragmatic studies. And there's very, very few pragmatic studies that are doing so because they often permit continuous adaptations, deviating from the original protocol and decreasing fidelity when you're actually going into the real world setting. Doesn't mean that you can't assess fidelity. It just is a very interesting challenge when it comes to assessing it in a pragmatic setting, and what some of those challenges are. Actually, Gupta et al. Is one of my examples from a big New York study, so we can refer to it a little bit more in that space. And in some of these pragmatic studies, there were no significant relationships found. And perhaps due to low variation in fidelity, like everybody was pretty high to begin with in terms of fidelity. So that might actually mediate your relationship with outcomes. And that is an interesting discussion point. But I just wanted to highlight that there are studies that have shown no relationship between fidelity and outcomes. So pragmatic research is a whole different ballgame that we have to figure out with fidelity and adaptations for sure. Which is awesome. Now we come to specific examples, and I'm going to run through these because I want to have at least 10 minutes for discussion. Essentially, Powers et al. Developed this amazing fidelity checklist building on the Walton recommendations. There were 5 versions that they iteratively developed by piloting and from input with an expert panel. Great iterator reliability, which is very hard to see in fidelity assessments. But look at the time it took to complete, 30 to 100 minutes. And that might be because of that guidance that was given to complete it. However, this retrospective review of intervention records is an interesting approach to measure fidelity. So just as an example for you all as you think about your own spaces. This is the New York study, a really cool study. I would really say go read this one out. They demonstrated moderate to high rates of implementation fidelity. There was some moderation by the actual implementation site and the people that were recruited in the implementation site. Here is where I think I've cited this because they showed that the relative advantage of the intervention that is being delivered has an impact on fidelity, right? So this was a prevention intervention preventing pre-diabetes in individuals. So that's not a tangible benefit for these for individuals. And so when it came to ratings around enactment, those were a little bit lower in this study. Which explains it because the benefits are not tangible. It could have reduced patients' motivation to participate fully in the intervention, right? But this is a great example on the use of quantitative methods in that relationship to outcomes. I think they have a paper planned on this in the next phase of their work to show assessment of quantitative assessments of fidelity as they relate to outcomes. Here's an example of their table and how they actually measured the fidelity. So just a really nice way of doing so. And then the final example, again, from the Ginsberg colleagues who talked about the complex team-based interventions and provided some guidance for the field. But in their own informed trial, what was really interesting to see is that, it took me like 5 to 6 times reading this work to understand this, but it was, what they said was, because the teams that were delivering the intervention perceived the importance of the intervention, they had higher amount of team communications to coordinate all of this work, which led to high fidelity enactment. And that might have an important pathway effect on the outcomes of the trial, right? And so what they try to say is that is the important aspect of fidelity assessments, is to ensure that we are supporting the deliverers of the intervention. And that might have a very important impact on sustainability. So I think that for me, this has been a very important citation to say, why do we do all of this? Is so that we are ensuring sustainability. So with that, I will just end with saying, as I was preparing for this and as we were writing a chapter, we had so many questions, more than we were giving people answers, in this space. So one of these I introduced very early on. Our scientific enterprise is focused on innovation and not on replication. So how do you ensure the value of fidelity assessments in that space? And whether you guys all think that would challenges to maintaining fidelity be lower if we were designing them from the very beginning with a co-creation, transcreation lens? And then how do you balance fidelity and adaptations when serving communities or settings that are experiencing disparities, right? So I've just put like some of my favorite further readings in those reflection questions, but would love to hear your thoughts in this. And I'll stop share. And I see there are 24 chats. Wow. It's been active.
Yeah, I will help you, Prajakta, if that's helpful for you, because there were
Yeah.
some great questions coming up. Terrific presentation is the last comment, which I completely agree with. And you left us time for discussion, which is a rare occasion when I present. So I really thank you for that. I pulled out the questions from the chat that I have seen. So new questions are welcome to be added right now. Please go ahead and add them. I am going to start with the ones that I see. So please quickly get your questions in the chat while I go through these. So Prajakta, one of the like theme or questions was like, when do you start to think about fidelity assessment? How early, if you are working on an efficacy study, is that, you know, critical to talk about fidelity assessment, or do you wait for a later stage?
Oh gosh, I am no way an expert in this and haven't done it in enough studies to actually give you a generalized information. So like, I think I would like punt this to a lot of other experts in this room. But I feel like what in my little space, I have always ensured that we are, and again, this, I have to give a shout out to Anna Bauman, who's a big inspiration thought leader for me in this space as well, has been to like put it in the very beginning, or at least conceptually put it in. Maybe not in whole understanding of like how I'm going to measure it and what are the specific instruments and stuff that I'm going to use to measure it, but at least conceptually explain what are the core fidelity principles that would be important for the intervention that we are working on. If nothing else is permitted in that space, but then we've always put that in all of our grants or our project proposals to always begin with that this is what we would conceptualize important aspects of fidelity if we were to implement this intervention. I don't know if that answers, Borshika, and Russ, please chime in. Yeah.
Yeah, I think that that's great. Let me continue on because I think that you
Yeah.
addressed that. A kind of a follow-up question to that is when, and I'm going to a little bit interpret this to my own liking, but I apologize to the person who asked it, Liz. So when is it enough change to warranty to conduct a study to assess the impact of adaptation? So if you move from in-person to virtual, does that warranty for you that you have to assess whether that adaptation made a big enough difference in effectiveness or not?
Wow, that's a big one, right? And I think it's so context dependent, and from and has to be from the perspective of the developer of the intervention, right? And has to think about theory. Like all these three things have to like come together in like informing where's that, and the second example in the New York study actually acknowledged this as a limitation, that they said that because they had not thought about this conceptually and not had determined a priori cutoff levels. Like, what if you refer them to 5 interventions, but actually there are 10 interventions to refer to? But that patient may not need all 10 interventions. They only needed 5. So is that low fidelity because you had a 10 interventions to refer to? Or is it that it is appropriate and tailored to the audience? So it's a very it's a very tough question without considering all these aspects together. And hence that conceptualization of fidelity early on might be very helpful.
Super. Thank you so much, Prajakta. The usual "it depends" came up already, and it will continue, I'm sure. So I will add another question. You talked a little bit about how fidelity assessment has an impact on actual fidelity. That's how I made it or understood it. So would you suggest that assessing fidelity as an activity is an implementation strategy that increases uptake?
Yes, that's exactly what I was trying to get at in that, like, relationship between fidelity and implementation strategies. So there are, of course, strategies that will help you enhance, but then the Toomey et al. Article, which really specifies, keep it separate, keep the assessment strategy separate and keep the enhancement strategies separate. And so that's where I think, like, I was trying to say, let's like be better in our reportings to like say, this is what influenced fidelity, and we were able to better our fidelity through this, but this is what was the assessment. And of course, there's going to be a relationship over there just by the act of, it's, what is it called? The doctor's coat effect. Like, you know, it's like
Yep.
by the act of actually
Yep.
doing it, you're going to
Yep.
actually influence some of this. So that
Yeah, let me see. That's wonderful, Prajakta, and it's very intriguing to me because we talk about adaptations as an implementation strategy, but fidelity assessment as an implementation strategy might be just what they need, that reminder. Russ, would you mind to jump in and see whether you have any priority questions? I know that you were also skimming the chat, or any additions here.
Yeah, I would like to add one, and maybe I'm going to combine and probably totally mess it up. David's comment that he just added in there, and then kind of combine that with one of my own questions for Prajakta. And David's point, I don't know if you can read it, Prajakta, is that maybe part of the issue, or maybe a problem, is that we think about implementation strategies the same way as interventions. Rather than maybe a broader sense of management practices there. And then I think this is related, you could tell me, but if not, my own, something I've been mulling over was prompted by one of your last slides there, where you talked about the co-creation and involving doing that. Does that like enhance later fidelity to things? And one of the things, just to make it even more complicated, I was thinking about is, you know, we've got fidelity to the intervention, fidelity to the implementation strategy. Maybe one of the most important things is fidelity to principles of engagement. Before we get into what the intervention and the implementation strategies are, maybe that's equally or even more important if we really have fidelity that early on, our partners and things like that, and listening to them. Maybe that
Right.
fidelity might even be most important, a third type, to make it even more challenging.
Right. No, I think that's what I was reflecting on myself, is like, instead of saying like engaging stakeholders at the end, if we are to build them in from the very beginning, which is the encouragement in the field right now, might this actually be an easier exercise to do rather than like explaining to them at the end, like, here's what I want to do, right? And I love David's comments because that's the exact same thing that I have been reflecting on in the bottom of my presentation. I have like 3 other questions that I wanted to ask you all, right? Because one of the questions that I am struggling with also, like you say, management practices, I've been struggling with health services delivery. And so like, how do you take this literature that has been conceptualized for behavioral interventions and apply it to other spaces like health services delivery or management practices? And like the newer understanding of like what you present, like microcosting, or, you know, cost analysis, and how these implementer characteristics might be even more relevant. I think it becomes very forefront in my work in you know, community-based healthcare settings, which are like often resource limited, often cost is the big priority for anything over there. So I don't know, I really think we need to do a little bit more grounding of bringing this behavioral interventions to other services and thinking about conceptually, how does this apply now if the endpoint is not to change an individual behavior, but an organizational behavior. And so that might be a little bit of work to do, and happy to work with anyone who wants to lead that space, just because it's been really driving me nuts a lot in my own work.
Thank you so much, Prajakta. Fantastic presentation, great discussion. I wanted to acknowledge that there were other contributors in the chat, like John Overtright from Sweden made some really good comments that you all benefited from as you were reading it. Prajakta, we have saved this so you can read these on your own leisure. And
I will share slides
yes,
with
we
all
will
of
have
you.
those posted and the recordings. I appreciate it, Prajakta.
And they're
Thank
all
you so much,
linked, so they'll be good.
Yeah, we will have this all available. We provided the link. Thanks for the very lively conversation, and we will see you next month. And again, thank you so much, Prajakta. Bye, everyone.